South Carolina lawmakers want to make pandemic-related telehealth access continue permanently.
According to the most recent state data, there were more than 1.5 million telehealth interactions in 2021.
News 19's Becky Buds has the story.
Over the past few years, millions of people have relied on video or phone calls to talk to their doctors. Now, state lawmakers are working on a bill that would eliminate pre-COVID barriers to telehealth access.
You can be right there with the OT in just a matter of moments. I don't have to drive 1 hour and a half or 2 hours to Charleston.
After the pandemic, many South Carolinians like Jack Gaddy traded the waiting room for their living room.
What the pandemic has shown us is that good, responsible health care can be delivered in a continuum of in-person and hybrid care.
Jimmy McElligott is the executive medical director for MUSC's Center for Telehealth. He says restrictions can make it harder for residents to access the care they need. The Telehealth and Telemedicine Modernization Act updates the definition of telehealth and removes in-person requirements to start a patient-provider relationship.
Well, it gives access to rural health, and that's huge. But it also gives access to the geriatric crowd, to the adolescent crowd.
It also expands telehealth to all licensed practitioners, not just doctors and physician assistants.
So your mental health counselors. And we saw during the pandemic that telehealth is great for mental health issues, substance and alcohol abuse. It removes the stigma.
The measure gives physicians more discretion to prescribe medicine virtually. Right now, McElligott says doctors must get permission from their practice board.
Now we do so much telehealth. That's like really burdensome, and there's a lot of people not being cared for because people just won't get special permissions and things.
Healthcare advocates say the legislation ultimately puts South Carolina ahead of other states and increases access to care for patients.
We can't go back to where we were. It was antiquated, ancient. We got to move forward, and this bill will help us to move forward.
The bill now heads to a full House committee and then will need to be approved by the full House. Reporting at the State House, Becky Buds, News 19 WLTX.
Back in 2016, the governor, who at the time was Nikki Haley, signed the South Carolina Telemedicine Act.